I performed a 16-hour surgery while pregnant. Here is what no one tells you about being a surgeon. I was 7 months pregnant when I had to perform emergency surgery on conjoined twins. As the lead pediatric surgeon, I couldn't pass this case to someone else. 20 hours later, PERT, after 16 hours of actual operating time, PERT, both babies survived. What most people don't understand about surgery isn't the physical stamina required, but the psychological weight we carry home. The human body isn't designed to stand perfectly still for hours while making life or death decisions. Yet that's exactly what surgery demands. When people ask me how surgeons endure those marathon procedures, they're usually imagining physical exhaustion. The reality is much more complex. During my residency, I once assisted on a 22-hour pancreatic reconstruction. What I remember most isn't the physical pain, but the mental chess game, PERT, constantly anticipating complications while your bladder screams for relief and your stomach growls audibly enough for the anesthesiologist to hear. The physical adaptations are straightforward. We train like athletes, though few would recognize it as such. I do specific core strengthening exercises daily to support my back during long cases. Many surgeons develop neck problems from looking down for hours, so I practice exercises to counter that strain. And yes, we all wear compression socks. Parent deep vein thrombosis is an occupational hazard when you can't move for hours. But here's what fascinates most people. We don't eat during surgeries not because it's forbidden, though it is, but because your body adapts. After years of training, your hunger response simply shifts. My body knows not to demand food during critical procedures. The ghrelin helps too. PERT, it's nature's appetite suppressant. The psychological demands are far more intense than the physical ones. Imagine making hundreds of precise decisions while knowing each one could permanently alter someone's life. Now imagine doing that in hour 15 of a procedure when your concentration should be failing, but absolutely cannot. During that conjoined twin separation, around hour 12, I hit what marathon runners call the wall. My pregnant back ached fiercely. My feet had gone numb. But the moment one twin's heart rate destabilized, everything physical vanished from my awareness. The body has remarkable ways of prioritizing what matters. We develop rituals to maintain focus. Some surgeons mentally recite specific music. I work through box seams. Others use visualization techniques borrowed from elite athletes. I mentally narrate each step as if teaching a student, which keeps me present and methodical. The hardest part isn't standing for hours, and it's the transition points. Disease fresh versus finishing strong requires different mental states. Major surgeries have natural breaking points. PARN, after removing a tumor before beginning reconstruction, after establishing blood flow to a transplanted organ. These moments allow for 90-second mental resets, though we rarely leave the operating field. My colleagues rotate more frequently than I do. As the lead surgeon, I stay from first incision to final closure on complex cases. My scrub nurses rotate every 4 hours. Residents and fellows step in and out based on their learning needs and stamina. This choreography is planned in advance for marathon cases. What nobody tells you is how surgery changes your perception of time. In the flow state of a complex procedure, 4 hours can feel like 40 minutes. Your world narrows to the surgical field, your hands, and the patient's vital signs. Everything else, parent hunger, fatigue, your pregnant bladder, PERT, becomes background noise. After that twin separation, I slept for 14 hours straight. My husband said I didn't move once, not even when my daughter kicked vigorously inside me. 3 months later, she was born healthy, apparently untroubled by her mother's surgical marathons. The greatest skill in surgery isn't technical prowess or encyclopedic knowledge. PERTness, the ability to make the same quality decision in hour 16 that you would make in hour 1. That's what separates good surgeons from great ones. And yes, we all have to pee eventually. We just learn to pick our moments very, very carefully.